About 30 years ago, I went to see a healthcare practitioner myself, and that practitioner was very focused on the cause of my health concerns, which was such a refreshing approach compared to just always being focused on the symptoms. Obviously, I was keen to get some improvement with my symptoms, but the fact that she included the questions, the investigations and all of that to just say, yep, this is what's happening for you right now, but why? Where did this start and how did that start? That I drove away from that appointment thinking, oh my God, that is definitely an area or a choice of healthcare that I would love to pursue for myself, for my own healthcare, but also as a healthcare practitioner, that was a no-brainer for me. That was the path I wanted to go on. My first experience after I graduated was in a clinic that did focus a lot on women, hormones and menstrual cycles. I feel like I've kind of organically landed in a place that includes gut health, because that really, there's no conditions of disease really that don't start at the root cause of the gut, but also there is a strong interest on my part in women and hormones, or just women's health in general, whether that's fertility, perimenopause, postmenopause, pretty much the whole journey for women. I love seeing patients when they come and they say, I want to make changes. I want to see things differently. I'm here, I want to be over there, but I can't work out how to get there. And I think, fantastic. That's the place that I think functional medicine has absolutely got a journey and a program to carry and hold that person's hand from here to there. It's like a bridge. There are occasions when patients come and they're not ready, and that's okay. That's fine. We're here to help them work that out sometimes. But if they are ready for it, I think then let's let the magic happen. I think for me it would have to be the realisation that how much their diet may be making them sick. That sounds very dramatic, but if we even wound that back a little bit and said how much is their diet contributing to them feeling so unwell. So to put a perfect example to this was a patient who came to see me a few years ago. She was struggling to sit in the chair when we were doing the appointment, the initial appointment, and she had a lot of body pain, joint inflammation, joint discomfort. She had actually been at the ER of the hospital where I was at the time, only a couple of days before. Her discomfort and pain had become so severe that she ended up just getting her husband to take her to ER. We talked about what other things were going on for her, of course, as we do, and we spent a lot of time talking about the symptoms that she was currently experiencing. She felt like she had a list, which often a lot of patients feel. They've got a big list of symptoms. And we got to the end of it, and I had a few ideas, as we don't like to guess, but we can start to get some thoughts about what might be going on as people tell us their story. So we decided and agreed to go forward and then do some testing. But in the meantime, I said, look, just start doing this. And all it was dietary modification. So just start doing a little bit of this over the next couple of weeks. And then when you come back, we'll talk more about where the next steps are. 2 weeks later, I almost didn't recognise her when she walked in. And it was 2 weeks. And all she had done was some of the modification of the diet that I'd shared with her. And I said to her, how are you going? You look quite different. And she said, I cannot believe the difference in this short amount of time. And when we started to unpack that and go through it, we started to go back to some of the symptoms that she'd come in with 2 weeks before. And I was saying, how are your headaches going? What's happening with your back pain? Are you getting any more of that sort of radiating joint pain? No, sitting in the chair beautifully. And I just I was blown away as much as she was. So for me, that's been, and that's not the only, there's been plenty of times that's happened. And for me, I think that sort of stuff is really powerful. And I think patients really appreciate the fact that that empowers them that empowers them, because they realise now they've got the opportunity to take the reins and actually have an influence on their health themselves, with a bit of guidance, of course. Working with me, I will do everything to support you. I will come along on the journey with you, and I will be excited with you when we get some breakthroughs, some celebrations, when we uncover things. I'll commiserate with you if you're taking 2 steps forward and 4 back. It's a privilege to be on that journey with people and to participate in their, sometimes it's a life-changing awakening, and finding that seeing the lights come on in their eyes, that's one of the things that I will do with and to completely celebrate with them through their journey. The Medicare system. So, and that's not to disrespect, there are countries in the world that don't have a Medicare system, so I really am mindful of that. But if we were able to flip our Medicare system on its head and support people through their journey of preventative health care, when people are investing in their health, I would love it if there was some world where the government was able to give them support in that, rather than waiting until they get the financial support when they're extremely unwell. It would be wonderful to see governments investing in wellness as much as illness. And I know that there is an element of that that's really important, but it would be great to see if there was a bit of a combination, I think.